Novel coronavirus cases in PH likely to climb further, expert by CNN Philippines staff. Published January 31, 2020, 9 hours 36 minutes and 14 seconds AM. Updated January 31, 2020, 12 hours 16 minutes and 0 seconds PM. Metro Manila, CNN Philippines, January 31. More novel coronavirus cases in the Philippines are likely to be confirmed in the next couple of days as the 2-week incubation period of the disease passes, a former health secretary said. Esperanza Cabral, who served as head of the Department of Health in 2010, said she expects the tally of the novel coronavirus 2019 NCOV cases in the country to keep climbing. Dadami pa, yan kasi hindi naman tayo nagpipigil ng maraming daw na pumasok dito mula sa areas na merong cases ng coronavirus. More cases will be reported because we didn't issue a travel ban for any visitors coming in from areas with confirmed cases of the coronavirus, Cabral said in a separate interview. She added that the cases are bound to go up to factor in the incubation period of the disease, which ranges from 2 days to 2 weeks. People who have been to China and able to come in through this period are only experiencing symptoms now. Saka lang sila pupunta sa doktor. That's the only time they will visit a doctor, Cabral said. CNN International reported that there are over 9,700 cases worldwide, with 213 people dead in mainland China as of early Friday. The 2019 NCOV has spread to 23 countries. Cabral acknowledged the speed of 2019 nCoV's spread compared to previous viral diseases. She pointed out that the severe acute respiratory syndrome or SARS outbreak in 2003 took 9 months to infect less than 10,000 people. In contrast, the number of 2019 NCOV infections are close to 10,000 in just a month. Authorities earlier confirmed the country's first novel coronavirus case, a 38-year-old Chinese woman who visited Wuhan City and flew to Cebu, Dumaguete and Manila last week. The woman is well, with the occasional cough, and is currently under isolation at the San Lazaro Hospital in Manila, DOE Epidemiology Bureau head Dr. Ferchito Avellino said. Another person is under observation in the same hospital, with the results of the test conducted in Australia expected in 2 days. Avellino told CNN Philippines the source that there are more patients being observed for possible infection with the virus, a day after authorities reported the first confirmed case in Manila. The number nearly doubled from the 29 suspected cases as of Thursday afternoon. However, he later clarified that the 56 cases are being probed as 2019 NCOV-related health events, which includes 29 patients under investigation for the virus. The distinction between 2019 NCOV-related health events and patients under investigation was not immediately clear. Avellino has not responded to further questions and calls. Contact tracing DOE epidemiologists have been sent to Central Visayas to track down people who have been in contact with the woman, particularly those who sat near her in the flights she took, and those who interacted with her in a resort in Dumaguete where she stayed for 4 days. Authorities have traced the woman's travel history and found that she only stayed in Cebu to catch a flight to Dumaguete, before heading to Manila where she got checked. Avellino said the woman had no signs of the disease except for the occasional cough. At the time she arrived in the Philippines, she never had any fever. She passed through the Bureau of Quarantine thermal scanning. She could have been repressing her cough or has not been coughing that much, so people would not notice she had that kind of condition, the DOE official said.